Hey everybody, this is Trey Maddox. I'll be doing your clinic orientation for NU455. I wish we could have done orientation in person. I just thought making a video recording would be a lot more convenient for all of you. I know, because of the bad weather, that your schedules are all jam-packed now. So please just watch the video. If you have any questions, you can call me, you can email me, you can come by my office. There's no such thing as a stupid question, so just let me know if you don't understand something fully. What we'll mainly be talking about today is just clinical expectations. I know that you've all done clinicals, you pretty much know what to expect. So this is just be review for you, and you just need to know what to expect with my clinicals. So we'll mainly go over the clinical expectations document. That document is uploaded in Canvas. All my documents for the clinicals are uploaded in Canvas. So just be familiar with all of them. The first thing I want to talk about is clinical assignments. So there's a clinical assignments document. It's got all your names listed, and it has whether you're going to an alt site, whether you're a team leader, or whether you're a team member. There are two teams. There's a patient team 1 and 2, and there's a team leader 1 and 2. As for the alt site, I'm not sure if we're going to have an alt site this rotation. I haven't heard word yet. As soon as I learn something, I will let you know whether we're going to alt site or not. Last semester, we went to the wound care clinic, and it was a good experience. So if you're listed as going to the alt site and we end up not doing that, don't worry about that. I'll just reassign you for patient team 1 or 2, so don't worry about that. Let's see, we'll go over clinical expectations first. Okay, so we're doing Baptist Memorial Hospital, Golden Triangle. If anybody has any questions about how to get there, let me know, but we're going to go to the 3rd floor of the patient tower. You'll park in the parking lot by the walking track. Please do not park in the patient tower parking lot. Baptist watches that pretty closely. The clinical assignments, they are posted. I meant to mention I made those assignments pretty much at random. If you have an issue with your assignment, please just let me know and we can talk about it. But I just had to put people somewhere. I had to assign everybody to either one of the patient teams, team leaders, or alt sites. The time, if you're a team leader, you will need to be on the 3rd floor at 6 o'clock, and that's to make your patient team assignments. That your team and the alt site students, they will need to be in the lobby by the gift shop of the patient tower by 6:30. Okay. So team leaders need to be on the 3rd floor at 6 o'clock. Team members and alt site students need to be in the lobby by the gift shop in the patient tower by 6:30. Even 1 minute late is tardy. If you're going to be absent, refer to your BSN guidelines and your policies. Remember that an excuse is required if you're absent. Even if the absence is excused, you will be required to make up missed time. Dress, I ask everybody to dress professionally. You all know how you should be dressing at this point. You need to have your name badges where people can see them. If you're dressed inappropriately, you may be asked to leave. Clinical paperwork. So your critical thinking exercises are your alt site, your team leader exercise, and your concept map. The concept map is required every rotation unless you have a voucher. Okay, so for this rotation, every rotation, you must complete a concept map unless you have a voucher. If there's any questions about that, please let me know. But the concept map has to be done every rotation unless you have a voucher. And for some odd reason, that question always gets asked. I don't know why, but it does. Okay, medication administration. Please have a basic, good understanding of all the medications that you plan to give. Know the drug class, know why your patient is getting the drug, know the dose of the drug, is it a safe dose, the route, all your nursing considerations, any incompatibilities to consider, any contraindications to apply for that patient, any major side effects, what parameters should be measured, if it's an IV medication, how fast, what dose is being given. Please just have a basic, good understanding of what you're giving. This has happened a few times in clinicals. The student tells me they're ready to give medication. I start asking, well, what is this for? And they don't know. And that's a problem. Please know what you're giving, okay? You can give medications with me, and you can give medications with another nurse, okay? That can be an LPN, and it can be an RN. It does not have to be me. I know that for time-sensitive medications I may not always be around, and it may be where you have to go with that patient's nurse. That is completely fine. Just let me know that that's what you plan to do, okay? Always be prompt and courteous to staff and patients. Remember to keep patient confidentiality at all times. Always remember that we are Baptist guests. They do not have to allow us to be there. We are there as their visitors. We are there as their guests. So we need to be respectful and helpful to them. We need to be very appreciative that they allow us to do our clinical time there. Also think about, if you want to work there, you need to be making good relationships now. You need to show them that you would be a very good hire. Just remember that they are watching you, and you want the nurses there to brag on you, and sometimes they do. So just remember that. For lunch, Baptist has a cafeteria, and they have a corner cafe. You can bring your own lunch. That's completely fine. Just think about maybe bringing an ice pack to keep it cool. We have an hour lunch break. With my past clinicals, we have all went together. We can talk about that if for some reason we need to go in groups. We'll just talk about that. It may be where you need to be on the floor after 12 o'clock. So we'll talk about that. Don't worry about that too much. Let's go over some team member requirements. So be in the lobby at 6:30. Receive your report from your team leader and the primary nurse. Be prepared to report to your team leader and discuss medications before discussing them with me or your nurse. This is very important. Again, just make sure that you discuss what medications you're giving with your team leader before you talk about them with me. And that's just kind of a safeguard that it tells me that you have looked up your medications, that your team leader is aware of what you're giving. And this is all just for you to have a good understanding of what you're giving. And team leaders, just remember, if your team member is giving a medication and they don't seem to really know what they're giving, just remember that's a poor reflection on your part, because you need to be reviewing your medications with your team members, okay? Complete your assessment on your patient and a narrative write-up and present to your team leader by 10 o'clock. Under my documents, I have a physical assessment sheet. It is a very simple physical assessment. Please use my sheet. If you have any questions about that, let me know. Sometimes other students have wanted to use one of theirs, and I would rather everybody just use the one that I've uploaded. It's very simple and very easy to read. For your narrative write-up, what that means is just basically a head-to-toe assessment in written form. So, for instance, Mr. Maddox is a 60-year-old male. He was admitted for pneumonia, and then you give your head-to-toe assessment. What that does, it improves your assessment skills, and it also improves your reporting skills. So when you give an oral report to the oncoming shift, you need to understand the proper verbiage to use, and that's what the narrative write-up does. Some other responsibilities: do your own vital signs at 8 o'clock and 12 o'clock. This has come up before. We've had other clinical groups on the floor, and I've had students come up and say, Mr. Maddox, the other student, did the 8 o'clock vitals, or the tech did the 8 o'clock vitals, so I didn't do them. Listen, I want everybody to become proficient in doing their own vitals, because even as an RN, you will do your vitals, I promise you. So 8 o'clock vitals, 12 o'clock vitals, make sure that you do those and you chart those. Beds and baths, make sure that those are charted. If your patient needs a bath, make sure that gets done in the morning if you can. Diet trays, if your patient needs assistance with eating, please do that. You need to practice, performing all kinds of patient care. Sometimes the PCA is not available for those types of things. Intake and output, if your patient has an order for I's and O's, you need to know that. Always look at your patient orders. If your patient has I's and O's ordered, if they have turn Q2 hours ordered, you need to know that, okay? Always look at your orders. If you need help finding the orders, I'll help you do that. Observe and perform any procedures on your patient. Assist the nurse or patient with any needs necessary. Assessing your own patient first thing every day. This is another reason I want the team members to have the physical assessments, and I want that sheet done before 10 o'clock. That assures me that you've assessed your patient. Remember, time management is so important. After you get report and you have a good understanding of that patient, you need to go lay eyeballs on that patient. You need to get your own assessment done. Because sometimes the report that we get does not always align with the patient's condition. So as soon as you can, I would advise go get your physical assessment done. You want to stay on time and you want to be organized. Giving all meds that you are checked off to give. Perform safety rounds every 1 hour or floor policy. I really want my students to do safety rounds every hour. Please start them no later than 8 o'clock. You'll have one patient apiece. Just get your safety rounds done every hour. Another thing I want to talk about is documenting, especially like safety rounds. Documentation is so important in our profession. We have to document accurately everything that we did for that patient. Just remember, if you do something for that patient and you don't document it, there is no legal proof of you performing that. What we document is so important, and I want to teach y'all that while you're with me. And remember, there is a certain way to chart. Say you're doing safety checks. I'm gonna give you an example. Say you did a safety round at 7:50. Um, Say you did one at 9:15. There is You have to think about how that looks. There is no safety round charted for 8 o'clock. And you could argue, well, the 7:50 was my 8 o'clock. I just went early. You just have to remember how that looks. You want to do very timely safety rounds, and you want to document very timely safety rounds. Just remember that, okay? If a pain medication is given, a pain reassessment must be done within 60 minutes. This is the same thing I've been talking about with documentation, and Baptist is very particular on pain reassessments. If you were to give a pain medication, we need to document what kind of pain that patient was having, certain variables. We need to document what we did. Within 60 minutes, a pain reassessment has to be done. It cannot be done at 61 minutes or later, or it's late, okay? And this is something that the hospital looks at, JACO looks at it. So if you give a pain medication, even if it's Tylenol or Motrin, a pain reassessment must be charted within 60 minutes. Let's see, be ready to take a lunch break at 12 o'clock. And 12 o'clock is just a goal I want to have. I just want to make sure that all our morning tasks are done and that we are ready to go to lunch at 12 o'clock. If there is something going on with your patient and you need to be on the floor after 12 o'clock, just let me know. But I just want to stay organized. Report to your team leader, primary nurse at completion of your shift. Have your work done and charted well in advance of 1600. I really like doing post-clinical debriefings with my students. I feel like that's the best way to process what we learned that day. And sometimes it opens our eyes to learning new things that we didn't really see. Sometimes it just takes a whole group discussion of what we saw and learned that day. So let's just have all our work done and charted before 1600. All right, team leaders, let's talk about some of your expectations. Again, be on the third floor at 6 o'clock, and this is to make your patient assignments. I want you to pick your team's patients. If you need any help with that, just let me know. The staff nurses on the floor are also very helpful. If you want to ask them, well, who do you think would be a good patient? They usually have some pretty good feedback. I would also ask them, is this patient going to be discharged today? Because you probably don't want that patient if you know they're going home that day. Just be thinking about what patients would be, good picks for my team. Just think about that. Get nurse PCA assignments and obtain thorough report. Give report to your team and to me, including morning meds. Just make sure that your team has a very good report coming from you, okay? I do want to also know what's going on with your patients, but it's most important that your team knows what's going on with them. Be available for assistance with assessments, med reports, lab consultation, treatments, procedures, etc. Just remember the purpose of the team leader assignment is to prepare you for what a charge nurse does. And in my opinion, team leaders, charge nurses, they are there to assist their team. I know that you have almost a management role in a way, but you are still there to assist your team. You're there to help them with anything they need. If your team members need you to help them give a bath, look up a medication, turn your patient, please be available for your team. That is basically what the team leader assignment is designed to do. Report any abnormal findings to me. You will review all meds before your team member gives the medication. Remember, if your team member is giving a medication and they don't really understand what they're giving, just remember that's a poor reflection on you, because you were supposed to review that medication with your team member, okay? So if that team member gets counted off for not really understanding the medication, you probably will be counted off too. So just remember that. I also included this: please do not fret about late medications if the instructor or a nurse is not available to assist you with medication administration. So when we're giving medications, when we're doing any kind of nursing intervention, I want us to be on time, but I completely understand that I may not be available to help you give a medication. A nurse on the floor may not be available at the time for you to give a medication. And I do completely understand sometimes medications are just late. Just let me know, keep me updated about what's going on, and, tell me, Mr. Maddox, this is going to be late. As long as I understand that this is outside of your control, do not worry about any kind of being counted off on your part. Do not worry about that. Review all documentation with each student before entering into computer. Review all patient assessments and the narrative notes, and give your student feedback before turning into me. And just remember, it is your job to keep your team organized throughout the day. It's your responsibility for your team to be timely. So just remember all that. Let's see. Another thing, evaluate each team member on a student evaluation form and turn it in to me. And what that does is it tells me whether you thought your team did a good job, and you could point to different points of why you think they did a good job, and you can tell me if your team member did a bad job. Just be honest with that. I've also had some other team leaders that did one on themselves. You can do that if you want to. And I'll go over this point. Keep in mind that the team leader may receive below expectations if team members are not kept on task and make errors that the team leader could have prevented. And lastly, please keep your team members as busy as possible, as there's usually always work to be done. There is usually always something that needs to be done. There's always somebody that needs to be turned. A brief needs to be changed. A water pitcher needs to be refilled. When I did clinicals as a student, my preceptors were always telling us there's always something to be done. And it is true. There's always something that can be done. We are there to learn, but we're also there to be as helpful as we can to the patients and to the rest of the staff. That's pretty much it. Just like I said, if there's any questions, let me know. Please be timely with your charting. Make sure your charting is organized and on time. And if I approach you and tell you, hey, you charted this, we need to go back and chart this, please don't be offended. I'm just trying to teach you. I'm just trying to show you the right way to document. So just remember, I'm just there to help you learn. This does come up often in clinicals. We have patients who are turned Q2 hours often. Please make sure that that gets done and documented every 2 hours. Even if you know that you're going to be off the floor for lunch or whatever, you're responsible that that patient gets turned. If you need to delegate that task to a PCA or someone else, please just make sure anything like that gets done and documented, okay? If you need to do something early, that's okay as well. Just make sure it gets done and documented. Sometimes, I'm still talking about turning. Sometimes patients get up in a chair and they'll want to sit in that chair for hours, and they're ordered to be turned every 2 hours. Even if they're sitting in a chair, they still need to be turned every 2 hours. If you turn them with, you can turn them in the chair with pillows. Just remember, everything that we chart is a reflection of what we actually did. So if they're at turn Q2 hours, but they've been in the chair for several hours, and we're not actually charting that they were being turned, the documentation is what it is. If there's no documentation that you turned them, then they weren't turned. If that patient can turn themselves, you need to chart that. This patient can turn themselves, that they're independent in their turning. All right, everybody, I think that's everything. I tried to keep it under 30 minutes. Like I said, if you have any questions, please let me know. I want to have a good clinical experience with everybody. I want this to be fun. I want us to learn. I want us to get to know each other better. So that's the end. Thank y'all.